Thank you so much for being with us again. It's good to see you again.
Thank you for
you and
being
your
here.
family. And this is my chance to say thank you to New England College for this great event and allowing me to come to it. My question, and I want to qualify it, is about Medicare. And I'm sure it's about 200,000 people here in New Hampshire on Medicare. But I also am concerned about my children, your children, what will be there in the future. Do you visualize, do you have some plans for putting it on a stronger financial footing for the young people here today, for my children, your children, and do something about the rising health costs? Thank you.
Thank you. Listen, whether it is Medicare or whether it's probably the number one financial challenge at the Department of Defense, even though we don't think about it in these terms, healthcare costs. Healthcare costs. You know, it's a $3 trillion industry. That's the size of the GDP of France, $3 trillion. And I was reminded when I went to Dartmouth Hitchcock Medical Center the other day, you know, in a room full of docs and researchers, you know, very informed people. I was reminded that of the $3 trillion that we look at in healthcare year over year, about 40% of that, maybe higher, is needless, superfluous spending, washing around. And I say, this is nuts. You know, we can talk about healthcare reform, but until we're ready to take that initial step and say, how do we get the excess cost out of the system? That's what's eating us alive. And those excess costs are resulting in the double-digit inflationary increases we're seeing year over year over year, and whether small business or whether the Pentagon is saying, you know, I've got two boys who are beginning their careers in the United States Navy. And so they're on a different health plan right now, you know, TRICARE, and I see, you know, what they're doing. And healthcare costs are impacting everybody across the board, and I say we've got to be smart about how we rid the system of excess superfluous costs. I want to get to a point in time, and I think the implications for Medicare are very real, to where patients can visit the doc's office with some information and some level of transparency about what is being offered. And they can choose what procedures are available to them and what the cost implications are. When was the last time you walked in a doc's office, you had a doctor explain the procedures and what they cost? Nobody knows what healthcare costs are, not the patients, not the doctors, by the way. And that then has to be coupled, that better knowledge of real costs, with an insurance program that does what insurance companies are supposed to do. They're supposed to take a risk, and they're supposed to offer us affordable, accessible policies, which they're not doing. And I say this is the other big part of the problem. We have a very limited marketplace when it comes to insurance offerings, and I say this nation is just beginning the conversation we need to have in terms of getting the insurance companies to do what they're supposed to do, to provide real options, coverage options for our people that are affordable and that are accessible. We just don't have that today. We work very hard in our state in trying to get us there. We looked at our 15% uninsured in our state. The largest subsection was the young, immortal population, 18 to 35 years of age. We're never going to die. Why would we need insurance? And even if we wanted it, there's nothing that we can afford. And we worked very hard in getting an affordable policy, kind of a stripped down, catastrophic policy. Very tough to do with the insurance companies. We've got something. And, you know, time will tell if this was an effective move. I believe it will prove to be an effective move. But if you wanted to buy an affordable policy, just for an example, in that state, in our state or another that does the same thing, you can, because of these cross-state border transactions. I want to drop the barriers that stand in the way of really making this insurance sector compete. They're not near where they need to be in terms of making that possible. Things like personalized medicine, I believe in the years to come, when we look at Medicare for the next generation, will make the delivery of healthcare and the cost of healthcare far different than they are today. When, thanks to the Human Genome Project and the molecular biology that has been done over the years, the way that we're able to assess and analyze human disease and tackle human disease early as opposed to late, and assess and analyze in individuals based upon their DNA what you have a predisposition for. So you're able to anticipate disease before the very end when it becomes extremely expensive, and you can take preventive and preemptive measures. That's where healthcare is going longer term, and I think it's a very, very exciting future. I'm an optimist when I take a look at that. And I say finally, things like end of life care, where it becomes very, very expensive. There should be a much different way of delivering that kind of care at home, as opposed to in very, very expensive hospitals and institutions. We need a whole lot more of those kinds of options that I believe will address costs. So that's a long way of saying, in my head, there's a lot of thinking about the whole cost side of Medicare and healthcare generally, because we'll keep having this conversation. At the end of the day, we're going to find ourselves right back with this basic premise, and that is, we've got to deal with costs if we're going to do anything about real healthcare reform longer term that will help our people.
Thank you.
Yes, sir.